Imagine this. You're walking through a park and suddenly someone near you collapses. They're on the ground, not moving, not breathing, and the people around them look frozen and unsure of what to do. Every second matters. What if this person's life depended on you? Would you know how to respond? That is where CPR comes in. CPR keeps blood and oxygen flowing to the brain and heart when the heart suddenly stops beating. The American Heart Association says quick and effective CPR can double or even triple a person's chances of survival after cardiac arrest. Even if you've never taken a CPR class before, by the end of this speech, you'll understand the key steps to act with confidence in an emergency just like this one. Step 1. Check the scene and the person. The first thing you do is to make sure the area is safe for you. You don't want to rush in if there's any danger from traffic, fire, or electrical hazards. Look around quickly. Once it is safe, move closer to the person, tap their shoulder, and ask them loudly, "Are you okay?" Look for signs of normal breathing, watch the chest for any movement, or listen for air coming out of their mouth or nose. If there is no response, no movement, and no normal breathing, they might be in cardiac arrest. At this point, you'll have to act fast. According to the Centers of Disease Control and Prevention, more than 350,000 people in the USA experience cardiac arrest outside of a hospital each year. The odds of survival drop sharply with every minute that passes without CPR, and that is why your quick response matters more than anything else. If the person is unresponsive but breathing, roll them onto their side into a recovery position and stay with them until help arrives. But if they are not breathing, you must start CPR immediately. Step 2. Call for help. Once you know the person isn't responding or breathing, the next step is to call for help. You can't do CPR effectively and call 911 at the same time. So if others are nearby, point to someone and say, "You, call 911 now." This direct instruction avoids confusion and saves precious seconds. If you are alone, call 911 on speakerphone or Siri while you start compressions. The dispatcher will guide you through CPR step by step. If there is an AED, have someone grab it. These devices are often found in gyms, airports, and even schools. They are designed for anyone to use, even with no training. The machine gives you clear voice instructions and won't deliver a shock unless it detects irregular heart rhythm that requires it. The American Red Cross notes that using an AED within a few seconds of cardiac arrest greatly increases the chances of survival. Step 3, begin chest compressions and rescue breaths. Now here comes the hands-on part of CPR itself. Knee besides the person, place the knee of one of your hands on the center of their chest right between your nipples and put the other hand on top. Interlock your fingers and keep your elbows straight. Position your shoulders directly over your hands so you can use your body weight and not just your arms to push down. Push hard and fast. At least 2 inches deep for adults at the rate of 100 to 120 compressions per minute. The rhythm, "Staying Alive" by Bees Gees, matches the speed perfectly. So if that song pops up in your head, keep the beat going. After 30 compressions, give 2 rescue breaths. And here's how. Tilt the head back slightly, lift the chin to open the airway, pinch the nose shut, and seal your mouth over theirs. Give a steady breath lasting about 1 second, enough to make the chest rise. Give a second breath, then go right back to compressions. If you are not trained or feel uncomfortable for giving rescue breaths, do hands-on only CPR. Continuous chest compressions without stopping. Hands-only CPR is still highly effective and can keep oxygen flowing until professionals arrive. Keep repeating cycles of 30 compressions and 2 breaths. Don't stop until the person starts breathing or train helps take over or you're too exhausted to continue. During this process, stay calm and focused. The sound of someone gasping or even twitching doesn't mean they're breathing normally. Those are just reflexes. Keep going until you see real signs of life or emergency responders take over. Every second without CPR lowers survival chances by 7 to 10%. By starting CPR right away, you're literally buying time for the heart and brain. Paramedics can restart the heart with the defibrillator, but only if the brain is still receiving oxygen. You do not need to be a healthcare worker to make a difference. Many CPR saves come from regular people who stepped in during an emergency. CPR isn't complicated at all. It's all about acting fast and not hesitating. When someone's heart stops, you are their best chance until help arrives. The next time you see a CPR training course offered, sign up. It only takes a few hours to learn because it could save someone one day and it could save someone's life.